It's a long way from Tanzania to Tel Aviv. But for 6-year-old Salma Isaac, this will prove a life-saving journey. She has come here to visit another Tanzanian, Dr. Godrey. He moved to Israel 5 years ago to train as his country's first ever pediatric heart surgeon.
Salma. Okay, Salma, una miaka mingapi?
Salma tells him she enjoys school, dreams of becoming a teacher, and loves to jump rope with her friends, but can't because it makes her sick. An ultrasound reveals why.
This is supposed to be all the way up to here.
There is a hole in Salma's heart, and blockages to her arteries mean no matter how hard her tiny heart beats, it won't pump enough oxygenated blood to her lungs. Without open heart surgery, there is no question Salma will die before her 21st birthday. And so begins the painstaking process of repairing and rebuilding, piece by tiny piece, a broken heart.
You see that the aorta is pulling a lot, so be careful, okay?
Australia's Pratt Foundation has funded the training of the 7-strong Tanzanian heart team. With at least 150,000 Tanzanian children diagnosed with congenital heart disease, their task is enormous.
In our list of pediatric cardiology, we have already more than 400 patients waiting. So you can realize how difficult situation this is.
How many Tanzanian children have died needlessly because there isn't someone like you there to save them?
In average, in a day, you can have like 5 or 6 children dying. If 24 hours passes and maybe we have 1 death or 2 deaths, this is actually like a surprise. And every doctor feels very good that at least we didn't have maybe many children as usual dying.
The surgical team has been operating on young Salma for about 3 hours now, and it is simply remarkable to witness. It's the hope of these doctors and nurses to one day carry out these types of life-saving operations at home in Tanzania. But like each procedure, that will take time and patience. What difference will this operation make to Salma's life?
At the end of surgery, most nephrology patients, they live a normal life.
After close to 5 hours,
we are restarting the heartbeat.
An ultrasound reveals Salma's surgery has been a success.
She will be healthy. She'll be able to live normal life.
Godwin is extremely talented surgeon, and when he comes back with his team and the expertise that he acquired here, he will be able to save so many children.
Since 1995, 3,200 children from 46 developing nations have passed through this ward. Like Asma and her 4.5-month-old daughter Rosie, more than half have been Palestinian.
They ignore the race or the religion. They just treat you as a patient only. I didn't thought that they are this kind, and they have so many humanity.
Even during the recent conflict, Israeli and Palestinian medical teams worked side by side in operating theatres.
The relationships which are created between Israelis and Palestinians, whether it's Israeli doctors and Palestinian doctors, or whether it's between Israeli families and Palestinian families, gives a message of hope.
83 physicians have been trained by Save a Child's Heart and now use those skills to save young lives at home. 2 days after his latest operation,
In a day or two, she will be very good and maybe playing with other children.
another survivor, another memory.
When you take a look at a child that you have operated and you knew that this child maybe had a year or 2 years to live, and you see that you have given this child another 40 years or 50 years, you say, well, should I let 100 to die? Better to save the 10 rather than to let 100 die. So, because every life is important and it's priceless.
In Tel Aviv, Brett Mason, World News Australia.